from the left ventricle until the next beat, right? In this example, the ejection fraction would be 70 milliliters divided by 110 milliliters, or about 64%. A normal ejection fraction is around 50 to 70%. Between 40 to 50.
ठीक है, this is stroke volume 70 ml, 110 ml, total volume, stroke volume. ये ejection fraction है appropriate 64% का.
Would be considered borderline, and anything about 40% or less would indicate systolic heart failure, because the heart's only squeezing out a little bit of blood each. So in our example, if the total volume of the left ventricle is 110 milliliters, but only 44 milliliters was pumped out with each beat, then you have 44 milliliters divided by 110 milliliters, which is 40%. And we would say that person is in systolic heart failure. Now, in addition to systolic heart failure, you've also got diastolic heart failure, which is where the heart's squeezing hard enough, but not filling quite enough. In this case, again, the stroke volume is low, but the ejection fraction is normal. How's that? Well, it's not filling enough, so there's a low total volume, say about 69 milliliters. Well, even though both are low, 44 milliliters divided by 69 milliliters is still 64%. In this situation, the failure is caused by abnormal filling of the ventricle so that the chamber doesn't get fully loaded or stretched out in the first place. Another term for this is having a reduced preload, which is the volume of blood that's in the ventricle right before the ventricular muscle contracts. An important relationship between systolic and diastolic function is the Frank-Starling mechanism, which basically shows that loading up the ventricle with blood during diastole and stretching out the cardiac muscle makes it contract with more force, which increases stroke volume during systole. This is kind of like how stretching out a rubber band makes it snap back even harder, except that cardiac muscle is actively contracting, whereas the rubber band is passively going back to its relaxed state. Alright, so heart failure can affect the right ventricle or the left ventricle or both ventricles. So someone might have right-sided heart failure, left-sided heart failure, or both, which is called biventricular heart failure, each of which can have systolic or diastolic failure. Having said that, if less blood exits either ventricle, it'll affect the other since they work in series. So left-sided could cause right-sided, and vice versa. So these terms really refer to the primary problem affecting the heart, basically which one was first. Usually, left-sided heart failure is caused by systolic or pumping dysfunction. And this is typically due to some kind of damage to the myocardium, or the heart muscle, which means it can't contract as forcefully and pump blood as efficiently. Ischemic heart disease caused by coronary artery atherosclerosis, or plaque buildup, is the most common cause. In this case, less blood and oxygen gets through the coronary artery to the heart tissue, which damages the myocardium. Sometimes the coronary is blocked completely, and that person has a heart attack. They might be left with scar tissue that doesn't contract at all, which again means that the heart can't contract as forcefully. Long-standing hypertension is another common cause of heart failure. This is because as arterial pressure increases in the systemic circulation, it gets harder for the left ventricle to pump blood out into that hypertensive systemic circulation. To compensate, the left ventricle actually bulks up, and its muscles hypertrophy or grow so that the ventricle can contract with more force. The increase in muscle mass also means that there's a greater demand for oxygen by this extra muscle, so that even less blood solids go to the tissue. More demand and reduced supply means that some of the ventricular muscle starts to have weaker contractions, leading to systolic failure. Another potential cause would be dilated cardiomyopathy, where the heart chamber dilates or grows in size in an attempt to fill the ventricle with larger and larger volumes of blood, or preload, and stretch out the muscle walls and increase contraction strength via the Frank-Starling mechanism. Even though this can actually work for a little while, over time the muscle walls get thinner and weaker, eventually leading to muscles that are so thinned out that it causes systolic left-sided heart failure. Ultimately, the ventricular walls need to be the right size relative to the size of the chamber in order for the heart to work effectively. Any major deviation from that can lead to heart failure. Alright, even though systolic failure is the most common in left-sided heart failure, diastolic heart failure or filling dysfunction can also happen. In hypertension, remember how the left ventricle hypertrophy? Well, that hypertrophy is concentric, which means that the new sarcomeres are generated in parallel with existing ones. This means that as the heart muscle wall enlarges, it crowds into the ventricular chamber space, resulting in less room for blood, meaning that in addition to contributing to systolic dysfunction, hypertension also can cause diastolic heart failure. Concentric hypertrophy leading to diastolic failure can also be caused by aortic stenosis, which is a narrowing of the aortic valve opening, as well as by hypertrophic cardiomyopathy, an abnormal ventricular wall thickening, often from a genetic cause. Restrictive cardiomyopathies are yet another cause. In this case, the heart muscle gets stiffer and less compliant, and therefore the left ventricle can't easily stretch out and fill with as much blood, which leads to diastolic heart failure. When the heart doesn't pump out as much blood, there's decreased blood flow to the kidneys, which activates the renin-angiotensin aldosterone system, ultimately causing fluid retention, which fills the heart a bit more during diastole and increases preload, which increases contraction strength, again by the Frank-Starling mechanism. Unfortunately, just like the other strategies, in the long term, retaining fluid so that more fluid remains in the blood vessels typically leads to a large portion of it leaking into the tissues and can contribute to fluid buildup in the lungs and other parts of the body, which can worsen the symptoms of heart failure. Alright, so a major clinical sign of the heart not being able to pump enough blood forward to the body is that the blood starts to back up into the lungs. A backup of blood in the pulmonary veins and capillary beds can increase the pressure in the pulmonary artery and can also result in fluid moving from the blood vessels to the interstitial space, causing pulmonary edema or congestion. In the alveoli of the lungs, all this extra fluid makes oxygen and carbon dioxide exchange a lot harder, since a wider layer of fluid takes more time for oxygen and carbon dioxide to diffuse through, and therefore patients have dyspnea or trouble breathing, as well as orthopnea, which is difficulty breathing when lying down flat, since that allows venous blood to more easily flow back from the legs and the gut to the heart and eventually into the pulmonary circulation. This extra fluid in the lungs causes crackles or rails to be heard on auscultation while the patient breathes. If enough fluid fills some of these capillaries in the lungs, they can actually rupture, leaking blood into the alveoli. Alveolar macrophages then eat up these red blood cells, which causes them to take on this brownish color from iron buildup. And then they're called hemosiderin-laden macrophages, also known as heart failure cells. For left-sided heart failure, certain medications can be prescribed to help improve blood flow, like ACE inhibitors, which help dilate blood vessels, as well as diuretics to help reduce the overall fluid buildup in the body, which helps prevent hypertension from worsening the heart failure. Now let's switch gears and think about right-sided heart failure, which is actually often caused by left-sided heart failure. Okay, remember how fluid buildup increased the pressure in the pulmonary artery? Well, this increased pulmonary blood pressure makes it harder for the right side to pump blood into. In this case, the heart failure would be biventricular, since both ventricles are affected. Someone can also have isolated right-sided heart failure though. And an example of this would be a left-to-right cardiac shunt. In these cases, there might be a cardiac shunt like an atrial defect or a ventricular septal defect that allows blood to flow from the higher pressure left side to the lower pressure right side, which increases fluid volume on the right side and can eventually lead to concentric hypertrophy of the right ventricle, making it more prone to ischemia, which is a systolic dysfunction, and have a smaller volume and become less compliant, which is a diastolic dysfunction. Another potential cause of isolated right-sided failure is chronic lung disease. Lung diseases often make it hard to exchange oxygen, right? Well, in response to low oxygen levels, or hypoxia, the pulmonary arterioles constrict, which raises the pulmonary blood pressure. This, just like before, makes it harder for the right side of the heart to pump against, and can lead to right-sided hypertrophy and heart failure. When chronic lung disease leads to right-sided hypertrophy and failure, it's known as core pulmonality. With left-sided failure, blood gets backed up to the lungs. With right-sided failure, blood gets backed up to the body. And so patients have congestion in the veins of the systemic circulation. One common manifestation of this is jugular venous distension, where the jugular vein that brings blood back to the heart takes on more blood and becomes enlarged and distended in the neck. Also in the body, when blood backs up to the liver and the spleen, fluid can move into the interstitial spaces within those organs, and they can become enlarged, called hepatosplenomegaly, which can be painful. And if the liver is congested for long periods of time, patients can eventually develop cirrhosis and liver failure, which will be called cardiac cirrhosis. Excess interstitial fluid near the surface of the liver and spleen can also move right out into the peritoneal space as well. And since that cavity can take a lot of fluid before there's any increase in pressure, a lot of fluid can build up in the peritoneal space, which is called ascites. Finally, fluid that backs up into the interstitial space of the soft tissue of the legs causes edema, where the tissue is visibly swollen, and when you apply pressure to it, it leaves a pit, and takes a while to come back to its original place. This generally affects the legs in most people, because gravity generally causes the majority of the fluid to pool in the dependent parts of the body, which is the legs when you're standing, and the sacrum, essentially the lower back, when you're lying down. Right-sided heart failure will be treated similarly to left-sided heart failure, especially because it's often a result of left-sided heart failure. Therefore, medications like ACE inhibitors and diuretics might be prescribed. With heart failure, we saw that sometimes the muscle wall can stretch and thin out, or sometimes it can thicken and become ischemic. In either case, those heart cells get irritated, and this can lead to heart arrhythmias. With an arrhythmia, the ventricles don't contract and sink anymore, making them less able to pump blood out and worsening this whole situation. In some cases, patients might be prescribed with cardiac resynchronization therapy pacemakers, which can stimulate the ventricles to contract at the same time and potentially improve the blood pumped out. Alternatively, for heart failure in general, some people might have ventricular assist devices implanted, or VADs, which literally assist or help the heart pump blood. In end-stage situations, though, where other forms of treatment have failed, patients might have a heart transplant. Thanks for watching. You can help support us.
Pumps blood containing the oxygen and nutrients your body needs. The pumping sections of the heart are the right atrium, right ventricle, left atrium, and left ventricle. In your heart, oxygen-poor blood flows from your body through large veins into your right atrium. Next, your blood moves into your right ventricle, which contracts, sending blood out of the heart to pick up oxygen from your lungs. Oxygen-rich blood moves out of your lungs into your left atrium, then moves into your left ventricle. Finally, your left ventricle contracts, sending oxygen-rich blood out of your heart to your body. If you have heart failure, your heart has lost the ability to pump enough blood to meet your body's needs. You may have weak or damaged ventricular walls that are not able to push enough blood out of your heart. You may also have stiff and thickened ventricular walls that do not allow your heart to fill with enough blood. If you have left-sided heart failure, your left ventricle does not deliver enough oxygen-rich blood to your body, making you feel tired and out of breath. Your failing left ventricle also increases the blood pressure in the blood vessels between your lungs and left ventricle. This increased pressure forces fluid out of your blood and into your lung tissues, which makes it difficult for you to breathe. If you have right-sided heart failure, your right ventricle is unable to contract with enough force to push blood to your lungs. The result is a buildup of blood in your veins, which causes a buildup of fluid
Edema.
called edema throughout the tissues in your body.
Okay.
Over time, heart failure on either side of your heart results in weakened, enlarged ventricles that deliver less blood to your body.
Jugular vein.
To make up for the decreased amount of blood, your nervous system releases stress hormones that increase the speed and force of your heartbeat. Unfortunately, the continued release of these stress hormones makes your heart failure worse because they damage the muscle cells in your ventricles. The most common cause of heart failure is coronary artery disease. Other causes that damage your heart and lead to heart failure include high blood pressure, diabetes, diseased, infected, or damaged heart valves, diseased, infected, or damaged heart muscle, irregular heartbeats called arrhythmias, heart defects, poisons or substance abuse, lung diseases, and breathing problems during sleep called sleep apnea, devices or surgery. Diuretic medications reduce the swelling in your body by increasing the amount of urine produced by your kidneys. ACE inhibitors are medications that allow your blood vessels to expand. This helps decrease your blood pressure and prevents further damage to your heart by making it easier for your heart to pump blood. Beta blockers are medications that block the effects of stress hormones on your heart. Although beta blockers slow down your heartbeat, they are mainly used to protect your heart muscle from the long-term damage caused by stress hormones. You may need to make some lifestyle changes, including exercising on a regular basis, maintaining a healthy weight, quitting smoking, limiting salt and alcohol, and eating a heart-healthy diet. Surgeries for advanced heart failure include coronary artery bypass surgery to improve blood flow to your heart muscle, heart valve reconstruction surgery to improve blood flow through your heart, and left ventricle reconstruction surgery to remove damaged heart muscle. Surgeries for extreme heart failure include insertion of a device to help your heart pump blood
IVF.
and heart transplant.